Welcome to Tuesday Talks from General Practice Solutions. In today's episode, we are focusing on an area of primary care that directly influences both patient access and operational efficiency: appointment demand balancing and capacity planning. As demand continues to rise across general practice, ensuring that appointment capacity is aligned with patient need has become increasingly complex. Practices are expected to provide timely access, manage urgent demand and maintain continuity of care, all within finite clinical and administrative resource. Many practices experience clear peaks and troughs in demand throughout the week. Monday mornings, for example, are often significantly oversubscribed, while other sessions may be underutilized. Without a structured approach to managing this variation, appointment systems can quickly become reactive. This leads to long waiting times, patient frustration, and increased pressure on reception teams who are managing high volumes of incoming requests. Over time, this imbalance can also impact clinician workload, with some sessions becoming overburdened while others are not used to their full capacity. Capacity planning is not simply about increasing the number of appointments available. It is about using existing resource in the most effective and sustainable way. This includes reviewing appointment types, ensuring the appropriate skill mix across GPS, nurses and other clinicians, and aligning appointment availability with known patterns of demand. It also involves maintaining flexibility to respond to unexpected increases in demand, such as seasonal illness or local pressures, without destabilizing the wider system. A common challenge for practices is visibility. Without clear oversight of how appointment slots are being used, it can be difficult to identify inefficiencies or adjust processes in a timely manner. Slots may be used inconsistently, urgent appointments may be filled with routine cases, and opportunities to redirect patients to more appropriate services may be missed. This creates additional strain on GPS and reduces the overall effectiveness of the appointment system. General Practice Solutions supports practices by helping to structure appointment demand and capacity in a more controlled and balanced way. Our associates work within your existing systems to support appointment book oversight, monitor utilization, and ensure that slots are used appropriately in line with your access model. We help practices maintain a clear understanding of where demand is highest, where capacity is available, and how best to align the two. By introducing a more structured approach, practices can reduce bottlenecks and improve patient flow. Patients experience more consistent access, with clearer pathways to the right clinician or service. Reception teams benefit from having defined processes that support decision-making, reducing the pressure associated with high call volumes and complex booking requirements. Clinicians, in turn, are supported with more predictable and manageable clinics, allowing them to focus on delivering high-quality care. Effective demand balancing also supports wider service integration. By ensuring patients are directed appropriately, practices can make better use of multidisciplinary teams, including pharmacists, physiotherapists, and other allied health professionals. This helps protect GP capacity while ensuring patients receive care from the most appropriate clinician. From a governance perspective, structured capacity planning demonstrates that practices are actively managing access and demand. Clear data on utilization, appointment types, and patient flow supports internal decision-making and provides evidence for inspections and reviews. It also allows practices to adapt over time, refining their approach based on real activity rather than reactive changes. Ultimately, appointment demand balancing is about creating a sustainable system that works for both patients and staff. With the right structure in place, practices can move away from reactive firefighting and towards a more controlled, efficient and patient-centered model of care. Thank you for joining us for this week's episode of Tuesday Talks. If your practice would benefit from support with appointment demand balancing or capacity planning, General Practice Solutions can help. To discuss your requirements, please contact us on 0208-865-1942 or email inquiries@generalpracticesolutions.net. We look forward to joining you again next week.